As you may recall, in the whole month of November, we have been focusing on prostate cancer and various consequences of the treatment and also sexual dysfunction. We talk about radical prostatectomy, we talk about radiotherapy, and today we're going to talk about metastatic prostate cancer and how hormonal suppression may result in sexual dysfunction. As you can imagine, that if you suppress a man's hormone, the sex drive will be reduced and also induces this difficult to treat erectile dysfunction. Under such circumstance, conventional treatment such as the blue pill doesn't necessarily work. So what are the solutions for such difficult to treat erectile dysfunction? In fact, there are two ways. One of them is injectable directly into the penis itself, called intracavernosal injection. Such vasodilations will induce effective erection, but it doesn't work for everybody. Therefore, another form of treatment is a penile prosthesis. Effectively, this is a device inserted into the erectile tissues of the penis and make artificial erection possible. It actually has been introduced a long time before the blue pill in the 70s. So there are two forms of penile prosthesis. One type is called hydraulic expandables, and the other type is called malleable rods. Let's deal with a simple one first. Malleable rod essentially are the rods that surgeons put into the penis so that it can create an artificial erection. That itself is actually very effective, however, obviously is more invasive and less natural. The other form, which is the expandable hydraulics, essentially there are three components. There are two hydraulic cylinders that's being put into the erectile tissues of the penis. There's a pump that's hidden in the scrotum, and there's a reservoir of saline that will deliver to the actual erectile cylinders whenever the pump is switched on. Although this is most effective form of prosthesis, but however, sometimes the device itself might become faulty because after using it for a long time, they may be defective. So therefore, sometimes this might get infected and defective and may need change. So therefore, we don't necessarily need this to be inserted in all patients, especially the patient are responding to injections or medication, then prosthesis is not necessary. However, if truly patients do suffer from non-oral or injectable treated conditions of erectile dysfunction, penile prosthesis perhaps give the hope to patient to revive their sex life despite the treatment of difficult prostate cancer. Next week, we start fresh in the month of December. Obviously, over festivity, we want to make it slightly more humorous, and we're going to talk about various piercing in genitals and also in other parts, and we'll start talking about piercings around the nipples. Let's find out in next week's Putting Dr. G on the Spot.